Scripps has really been a pioneer in the field of electrophysiology, EP, and in arrhythmia management. I've been here for over 30 years and seen an incredible transition. We started in a little tiny room in radiology, almost a closet, and now we have probably the largest EP program on the West Coast. We have 6 EP labs and 2 hybrid ORs. We have 20 electrophysiologists on staff and over 40 staff working just in EP. So it's become a big, successful program that we're very proud of.
I am one of the newer employees at Scripps, and I joined the hospital earlier this year. What really attracted me to the group was the collegial atmosphere that is fostered by Scripps at the highest levels.
It begins with the greeters at the door, and it goes all the way up to the CEOs of the healthcare system. And in between are the doctors and the nurses that care for the patients on a daily basis. And it's really everyone's striving to provide the highest level of care to every patient that walks in the door. And that's basically treating our patients like family.
We kind of focus our care on the patient comes first. While we do research and teaching, the patient care is really the issue. All the 20 electrophysiologists do their own procedures. We don't have fellows or trainees doing them. We do research, but the research is clinically oriented to benefit patients. And that's why we have patients coming from far away to come here to get their care at Scripps.
We have a very high volume here at Scripps in device implantation and in ablation procedures. And so with that volume comes the expertise, comes more referral sources for us to maintain taking care of large numbers of patients.
I think we do about 4,000 total cases a year. About 2,000 of those are ablations or Watchman procedures, left atrial appendage closure procedures. We have several unique approaches to AFib ablation. Some of the unique things that we're doing here is we're taking a Convergent approach, a combined surgical and catheter ablation approach to AFib ablation.
The Convergent approach is relatively new. We were the first in San Diego to do it with the first patient, and the outcomes, from my personal experience, have been excellent, very, very promising. And it provides a method of partnership with the cardiothoracic surgeon to do an ablation via a minimally invasive small incision, just subxiphoid, which is underneath the sternum. Get to the back wall of the heart and ablate the entire back wall of the heart from an epicardial or outside of the heart perspective. And either on the same day or as a staged approach later, then the patient can undergo the typical minimally invasive endocardial or inside the heart approach from my specialty, or electrophysiology, where we go through the veins into the heart.
At Scripps, the physicians have access to the latest equipment, and we're able to do all modern aspects of electrophysiology, not limited by really anything. This includes things like the cryoablation, the cryoballoon, where in atrial fibrillation ablation, instead of using a thermal catheter and burning the areas that are causing the atrial fibrillation, we go in and freeze the areas, and this allows a more comprehensive lesion set. And there's lots of early evidence that this leads to better outcomes for the patient.
With regards to radiation reduction, that's kind of the forefront of our specialty, and we're able to do our procedures with minimal radiation, even procedures that traditionally would require an hour or more of radiation, we're doing with 10 minutes or less, and we're able to do that by using the latest three-dimensional mapping systems, and we have all 3 available here at Scripps. And we're also using a shield that allows us to do our procedures with minimal radiation to ourselves and to the patient.
We pride ourselves in having a safe environment for patients and staff to work, and excellent outcomes for our cases here. Scripps is a leader in arrhythmia care, and we hope to continue that long into the future.